glad to see that you're practicing social distancing. That looks very nice. Looks very good. I want to thank everybody for being here today. This morning I spoke with the leaders of the G7 nations, and they really had a good meeting. I think it was a very, very productive meeting. I also spoke with our nation's governors. And this afternoon, we're announcing new guidelines for every American to follow over the next 15 days as we combat the virus. Each and every one of us has a critical role to play in stopping the spread and transmission of the virus. We did this today. This was done by a lot of very talented people, some of whom are standing with me, and that's available. And Dr. Birx will be speaking about that in just a few minutes. It's important for the young and healthy people to understand that while they may experience milder symptoms, they can easily spread this virus, and they will spread it indeed, putting countless others in harm's way. We especially worry about our senior citizens. The White House Task Force meets every day and continually updates guidelines based on the fast evolving situation that this has become all over the world. It's all over the world. It's incredible what's happened in such a short period of time. On the guidelines of the task force, the new modeling conducted by Dr. Birx, and our consultation with governors, we've made the decision to further toughen the guidelines and blunt the infection now. We'd much rather be ahead of the curve than behind it, and that's what we are. Therefore, my administration is recommending that all Americans, including the young and healthy, work to engage in schooling from home when possible, avoid gathering in groups of more than 10 people, avoid discretionary travel, and avoid eating and drinking at bars, restaurants, and public food courts. If everyone makes this change or these critical changes and sacrifices now, we will rally together as one nation, and we will defeat the virus, and we're going to have a big celebration all together. With several weeks of focused action, we can turn the corner and turn it quickly. A lot of progress has been made. I'm also pleased to report today that a vaccine candidate has begun the phase 1 clinical trial. This is one of the fastest vaccine development launches in history, not even close. We're also racing to develop antiviral therapies and other treatments, and we've had some promising results, early results, but promising, to reduce the severity and the duration of the symptoms. And I have to say that our government is prepared to do whatever it takes. Whatever it takes, we're doing. We're doing it in every way. And with that, I'd like to just introduce Dr. Birx, who's going to discuss some of the things that we strongly recommend. Thank you.
Thank you, Mr. President. I think you know over the last months, we've taken very bold action to stop the virus from coming to our shores. And because of that, we gained time to really get together and understand the progress across the globe of what has worked and what hasn't worked. We now need to appeal to every single American so that they can have their role in stopping the spread of this virus. We've talked about things before about washing your hands, but we really want to focus on, if you are sick, no matter who you are, please stay home. If someone in your household is diagnosed with this virus, the entire household should quarantine in the house to prevent spread of the virus to others. The reason we're taking these strong and bold steps is because we know there is virus spread before you develop symptoms, and then we know that there's a large group, we don't know the precise percent yet, that actually is asymptomatic or has such mild cases that they continue to spread the virus. If your children are sick, please keep them home. Now to our older population or those with pre-existing medical conditions, everyone in the household needs to focus on protecting them. Everyone in the household. I want to speak particularly to our largest generation now, our millennials. I have the mom of 2 wonderful millennial young women who are bright and hardworking, and I will tell you what I told to them. They are the core group that will stop this virus. They are the group that communicates successfully independent of picking up a phone. They intuitively know how to contact each others without being in large social gatherings. We're asking all of them to hold their gatherings to under 10 people, not just in bars and restaurants, but in homes. We really want people to be separated at this.
In this room, and Dr. Burke said it very well, that in order to be able to contain and curtail this epidemic to not reach its maximum capability, we have a two-pillar approach, one of which I believe has been very effective in preventing the substantial seeding, and namely the travel restrictions that we've discussed many times in this room. The other, equally, if not more important, is when you have infection in your own country, which we do, and I could read the numbers, but they're really essentially what we've seen yesterday, incremental increases both globally. Behind where you think you are, if you think that today reflects where you really are. That's not word speak. It means if you think you're here, you're really here because you're
do what the White House is suggesting, how quickly you could turn this corner.
My favorite question, I ask it all the time. How many times, Anthony? I think I ask him that question every day, and I speak to Deborah, I speak to a lot of them. I get the opinion. So it seems to me that if we do a really good job, we'll not only hold the death down to a level that is much lower than the other way, had we not done a good job. But people are talking about July, August, something like that. So it could be right in that period of time where it washes through. Other people don't like that term, but where it washes through.
So is this the new normal until the height of the summer?
We'll see what happens, but they think August, could be July, could be longer than that. But I've asked that question many, many times. Yes.
That being said, Mr. President, Americans today and looking forward are living with so much anxiety and so much fear facing uncertainty right now. I'm curious, how are you talking to your own family about this? How are you talking to your youngest son? Do you empathize with this sense of anxiety? People are really scared.
Yeah. No, I think they are very scared. I think they see that we're doing a very professional job. We've been working with the governors and frankly, the mayors, local government at every level. We have FEMA totally involved. FEMA has been, usually we see FEMA for the hurricanes and the tornadoes. Now we have FEMA involved in this. They've been doing a fantastic job locally, working with people that they know because they worked, like as an example, in California, in the state of Washington. They work with them a lot on other things, and they're very familiar, so they're working on it. What you can do, and all you can do, is professional, totally competent. We have the best people in the world. We have really the greatest experts in the world. And someday soon, hopefully it'll end and we'll be back to where it was. But this came up, it came up so suddenly. Look, you were surprised. We were all surprised. We heard about it. We heard about reports from China that something was happening, and all of a sudden, we did make a good decision. We closed our borders because they've done a good job on one side, but on the other side, tremendous problems at the beginning. They had tremendous problems and great numbers of death. I think that we've done a fantastic job from just about every standpoint. With that being said, you look, no matter where you look, this is something, it's an invisible enemy. And but we are speaking all the time, not only with the people, but also the professional people, the nurses, the doctors. They have been doing a fantastic job. We are also working very much on getting them the kind of equipment that they need. And for the most part, they either have it or they will be getting it. But remember this, we want the governors, we want the mayors, we want them locally, from a local standpoint, because it can go quicker. We want them to work. And we had a great talk with the governors today. I think it was a really great talk. There's a tremendous coordination. There's a tremendous spirit that we have together with the governors. And that's pretty much, for the most part, bipartisan. Yeah.
Mr. President, you told John that you think this could wash through, as you said, July, August. You just told Steve when he asked you about a possibility of recession. You said it may be. I'm curious, if there is a recession, when do you think that might hit?
Well, I don't number one, determine recession. I just say this: we have an invisible enemy. We have a problem that a month ago nobody ever thought about. Nobody in the, I've read about it. I read about many years ago, 1917, 1918. I've seen all of the different problems similar to this that we've had. This is a bad one. This is a very bad one. This is bad in the sense that it's so contagious. It's just so contagious, sort of record-setting type contagion. And the good part is the young people they do very well, and healthy people do very well. Very, very bad for older people, especially older people with problems.
Putting a real priority on our extraordinary healthcare workers that are at this very hour coming alongside people that are struggling with the coronavirus and people that are concerned that they may have been exposed. The other piece is we're grateful that the legislation passed by the House of Representatives includes liability protection for N95 masks produced by companies like 3M in Minnesota, by Honeywell. Literally tens of millions of masks are produced every year for industrial purposes, for construction. But the health experts say they can be used just as readily to protect healthcare workers from respiratory ailments. 3M and other companies were not able to sell those to hospitals, but the president negotiated with the Democratic leadership of the House and Senate. We've added a provision to the bill that will literally, from one company alone, add another 30 million masks per month back to the marketplace. We're strengthening the supply chain, and healthcare workers around America can be absolutely certain that the president and our entire team are going to continue to put the health of America first and put first our healthcare workers across this country that are meeting the needs of the people of our country.